Charcot-Marie tooth disease is the most common peripheral neuropathy or inherited peripheral neuropathy that there is. There are other types of diseases that affect the nerves, diabetes, and things like that that are secondary in nature to the actual disease itself, but Charcot-Marie tooth disease, specifically CMT1A, is the most common inherited peripheral neuropathy and the one that we most commonly see in the orthopedic clinics. When we see a child who comes in and may have Charcot-Marie tooth disease, the things that would make us think of that diagnosis are parental complaints of the child tripping, the child having an ungainly gait. Most commonly early on they have flat feet. Unfortunately, all of these sorts of things are very common in the normal population, and so it becomes difficult for us to separate out what's normal and what's not normal. On the other hand, one of the things that my father taught me is that we always believe the parents, and when the parent comes in and says that there's something wrong, I know there's something wrong with my child, even if on our first examination we don't see something, we'll bring them back again and we'll reevaluate them over a period of time, because oftentimes the mother is right and we'll see something, and then once we identify that the child's having some difficulty with balance or having some weakness or up on their tiptoes, these sorts of things, that would start us down the road of looking at a neurologic cause for their problems. Diagnosis allows us to intervene early, and we know that the natural history of Charcot-Marie tooth disease is a progressive problem with increasing weakness and disability in children and adults, and they often will wind up with foot problems, severe deformities that need significant surgery to correct. If we can intervene early by making the diagnosis, establishing a treatment plan, putting them in physical therapy, utilizing stretching and bracing, things like this, we may be able to avoid the major surgeries down the line that have been required when they're identified as an adult.